healthy when we're not. And I think probably the most important thing
it's recording.
It's recording. You have no idea how much you are talking about in corporate boardrooms around the country in terms of healthcare. Because who makes the healthcare decisions in families? Yes. Men. Tell me the next time you see a billboard that has only men on it advertising anything with healthcare. You never see it. And never only kids. It's always the demographic of a 30 to 50-year-old woman. Why? Because you make the decisions for your husband, for your children, for your parents. I take great care of my daughters. My son, heck with him. He's not going to take with me in the future. It's the women who grow up and take care of their parents. So you make those decisions. So you're a real target group. And I think of it like the airplane thing, where they say, you know, if something the cabin is right and the oxygen mask come down, what's the first thing you do? You put it on your child. No, put it on yourself. If you don't put it on yourself, you're not going to be there to take care of your child. And the same type of thing, you have to take care of yourselves in order to take care of all the other people you have the responsibility for. So we're going to talk about heart disease, and heart disease really is what I call coronary artery disease, or blockages in the coronary or heart vessels. It begins innocuously in a nice clean vessel, a little damage to the vessel wall, then build up a plaque, as you see here, and it blocks the heart vessel and causes heart attacks. That's what we're going to talk about when I say heart disease, coronary artery disease. This is a picture from the operating room, where you can see a vessel with plaques in it. These are visible cholesterol plaques that are blocking vessels. And it's important for women. It is the #1 cause of death in women, more than breast cancer and lung cancer combined. So hear that. It is the #1 cause of death. All the other stuff tends to be a little glamorous. Gets the fundraising. But heart disease is the #1 killer. It has been every year in this country, except for 1 year, 1918. Now, none of you, I expect, were around then. Does anyone know what killed more people in 1918 than heart disease? The flu. Right. Responsible for 1 in 4 deaths annually. And you can see here, in Europe, only 1 in 6 deaths every 6 minutes. Here, 1 death every minute. And yet, just over half of women recognize it as the #1 killer. I was telling somebody a short while ago that I was talking to my 12-year-old daughter, who's a real bright girl. She's really smart. And she lives in a family with a physician and a nurse as parents. And I said to her, I was talking about giving this talk, and she said, well, why? Actually, she started with my red pen today to school, so I had to get another one. She was going to wear it to school, and I said, well, what do you think is the cause of death in women? She said, right off that, breast cancer. I said, no, it's heart disease. Come on, she says, well, I thought you were supposed to be saving people. It's like, well, anyway, so let's just give you an idea of what we're up against. So these are the heart disease death rates around the country, women age 35 and more, and obviously the darker it is, the worse it is. You can see higher death rates for darker. You know what this is called? I'll try this out on it. Do you all know what this is called? Right? I got 5 months, I've got that down. So do you all know what this is called? Y'all, this is the barbecue belt. You know, when I say that to people down here, everybody breaks into a grin. It's like what we say when you say snow up here. Everybody smiles. Down here they don't. But down here you say barbecue, someone smiles. I say, what do you smile about? Barbecue is taking sugar and putting it in, okay, maybe a little ketchup, but they're putting sugar on what you eat. And so, what do we see? We see a lot of heart disease. This is the barbecue belt. It's also called the Bible belt, but also the barbecue belt. And watch this. Watch this. In this area, in our Hampton Roads area, I apologize to the fellow, but look at the high rates here. You know, even compared to the rest of Virginia, we have pretty high rates of death in women from heart disease in this area. Pretty high rates. So we have to do something about that. And part of it is knowing what the problem is, knowing the enemy. So knowing the symptoms of heart disease, and they're listed here. We know these are healthcare professionals. Pain in the chest, the arms, the jaw. Anybody know why you get heart pain or angina in your neck? Does anyone know why? Because the heart, in the embryo, the heart travels from the neck down, and it carries the nerves with it. So when you get heart pain, it can be referred up into the neck and the jaw. My father, smart guy, very big businessman, real smart guy, called me one day and said to me, he's got to go to the dentist because he gets jaw pain after he eats and takes his walk. Wow. I said, no, you don't need the dentist. You need to go to the cardiologist. Is what you need. But people don't know that. Shortness of breath occurs, parasympathetic dyspnea, orthopnea, nausea, vomiting, fatigue, even indigestion. And I say, men take Tums. How many patients have I operated on whose presenting symptom was indigestion? They Tums full for the last 2 months until they had their heart attack and realized Tums don't prevent heart attacks. Okay? So this is a problem. Importantly, what are the symptoms in men versus women? More commonly in men we find chest pain and arm pain and some shortness of breath. But in women it's totally different. Arm pain, neck pain, shoulders, back, shortness of breath, nausea, vomiting, fatigue. Nausea, vomiting, fatigue. Much more common presenting symptoms in women. So women sit around waiting for the chest pain to go to the doctor. That's a fallacy. Okay? It's something that we need to think about. So what about the pain of heart disease? It's dull, it's aching. It's not technically pain. I have patients that come and see me. I say, well, Dr. Manu sent you to me and he said you're having chest pain. I don't have chest pain. You don't have any chest pain? No. His note says you have chest pain. You never had chest pain. I get chest pressure, but I never get any chest pain. So you have to be a little careful with the semantics. It's a dull, aching pressure. And what causes it? We say the 4 E's. Exertion, emotion, stress, eating, and the environment. We used to have something that's called the deer paradox up in upstate New York, where we have lots and lots and lots and lots of deer. And they get in the way of your cars, and they have lots of hunters. And I'm not so sure I agree with the hunting, although after hitting a couple of them, I'm not so sure it's a bad idea or not. But what we have is the deer paradox. And these overweight young males would go in the woods, and they would shoot a deer. And what do you have to do? You have to cut them open and gut them, and then you have to drag them out of the woods. So what do you have? You have exertion, right? Dragging the thing out of the woods. You have emotion because they're excited they killed the deer. Hopefully they don't have eating. I want them to get it home first. And then you have environment, which is the cold weather. And I've operated on half a dozen people upstate New York who's presenting symptom pain, dragging the deer out of the woods. As I say, the deer was dragged out of the woods, but smiling all the way. As the guy saying, wait a second, I'm having a heart attack. So the deer gets even. The time course is interesting. Stable versus unstable angina. Someone who has stable symptoms happen all the time with the same activity. It's much different from someone who has accelerating symptoms. They're getting worse and worse. Climbing fewer stairs and getting the symptoms. That's a predecessor to a heart attack. Little things folks sometimes don't know. And always remember silent ischemia, particularly in diabetics. Up to a half of diabetics in some studies never get chest pain. Never get it. They present with shortness of breath, fatigue, things like that. So if you're a diabetic, you shouldn't wait to have chest pain to think about heart disease. So how do we diagnose it? Of course, good history and physical, EKG, echocardiogram, stress test, and of course cardiac catheterization. Look for areas like this, where there is blockage in the vessel. And how do we treat it? We know about all the medications that are there. You have aspirin, statins, beta blockers, nitroglycerin, diuretics. Some people go and get stents. You can see here stents, little cages put inside the vessel to open it up. Some people end up having to have coronary bypass surgery, which is connecting arteries and veins to blood supplies and swinging them around the blockage and plugging it in. So there's a lot of treatment, a lot of ways to diagnose it. Now, this is the audience participation part. Okay? So, who's going to tell me, are there significant differences, though? We talk about diagnosing treatment. Are there differences between men and women with heart disease? Anybody? Yeah. Yes. Okay, good. Get the first one right. How about the next one? Does it present the same way?
No.
I've already given you that answer, right? Because the pain is a little bit different. So, of course, no. Do we diagnose with equal accuracy in men and women?
No.
Of course not. You get the short end of the stick. And do we treat it equally well?
No.
No, we don't. Are your brains full yet?
No.
No! So go on. All right. So why is there a difference? Well, first of all, part of the difference has to do with the biochemistry. You have something men do not besides empathy and vision and sense. You have estrogen. Sorry. So, you have estrogen, and estrogen protects against heart disease. Women have lower rates of heart disease at younger ages. A 40-year-old woman going to a doctor saying, I have chest pain, one of the first things the doctor thinks about is not heart disease. 50-year-old man, they think heart disease. They don't think injection-induced pumps. Symptoms occur 10 years earlier in women than in men. Unfortunately, diabetes has been shown in some studies to attenuate or even block the effect of estrogen. So you don't have the protection, not biochemically block, but stunt the impact that estrogen has. So women at a younger age have higher rates of heart disease when they have diabetes. Unfortunately, though, after menopause, the rates increase and exceed that in men. So the rate of heart disease in men goes like this. In women, it crosses like that. As soon as menopause occurs, 70, 80 years old women have higher rates of heart disease. And the big problem is that when you get your heart disease, you also have more advanced disease that we all get when we get to be 70 and diabetes, high blood pressure. I'll show you some statistics that bear that out and are very worrisome in that regard. So are men different than women? Of course. More likely to have fatigue, nausea, vomiting, I mentioned this already, shortness of breath, and perhaps even concerning, 2 out of 3 women know that chest pain, not just talking about healthcare workers, but 2 out of 3 women, not even in healthcare, know that chest pain is a symptom of heart disease. But only 1 out of 10 know that nausea and shortness of breath is symptoms of heart disease. Our treatment's different, yes. Unfortunately, women with heart attacks, who present with heart attacks, in careful studies that have looked at this, are less likely to receive aspirin, beta blockers, and to get a cardiac catheterization. Men, get in line, get your pills, get your cath. Women, let's wait on this. This is the truth. This is how it goes. I'll tell you a quick story. I read on a gentleman 10 to 15 years ago back, actually back in Massachusetts, it was more than that. A gentleman who owned a restaurant and successful operation, and afterwards he said, "You took good care of me, why don't you go out and have a steak?" I said, "You're not getting it, all right, first of all, but I will come out to your restaurant." So I went out to see him. And his wife greeted me. He was busy with the restaurant. And his wife walked me around the grounds with big bed and breakfast. And she said, "You know, I'm going to have to come see you too, maybe." I said, "Why?" She said, "Well, you know, I'm getting those same pains as my husband." I said, "Really?" She said, "Yeah, I've had them for a while." "Really? Have you gone to your doctor?" "Yeah, you know, it took me like 3 or 4 times before he finally would take me seriously." I said, "Really?" True story. And oh, but I got a study. He put me on one of those walk-in things. I said, "It comes." She goes, "Yeah." I said, "Do you have the results?" She goes, "That's in my trunk." She went and opened up her trunk and pulled out shoes and clothes. "Here's the results." She gave me, you know, I had oil on it, but I had a stress test result. She was pulled off the treadmill in 4 minutes because of PVC and SC changes. And I said, "When was the stress test result?" "About 6 months ago." "And what did he say?" "He told me just to take it easy." Wow. True story. True story. This is just an example of it, how it happens. And unfortunately, women are also unlikely to go timely reperfusion therapy during a balloon time. We see thrombolytic therapy, we see the angioplasty or undergo bypass surgery. And their outcomes are different. Women that present with a heart attack are more likely to die within a year than a man, more likely to have another heart attack in less than 6 years, and more likely to be in heart failure in less than 6 years. Part of this is the age effect. They present early because they don't have estrogen. So when women present with heart attacks, they're older and sicker. So this is the problem. They're also less likely to survive the hospital stay and to recover successfully. In other words, higher mortality rates with angioplasty and with surgery. This is a study I mentioned here. You can look at the numbers. The bottom line is the p-value, or the statistical significance, shows that for all of these categories, men do better than women. Early medical therapy, more men than women. Now you might look at this and say, well, we're talking a couple percentage points. But it's still statistically significant. And why? Because if you look at 80,000 people in the study and a difference of 2 percentage points, what's that? Who can do quick math? 80,000 times 2%. You're talking about over 1,500 people. If it's a 2% difference. Some of these, the difference is greater. But even a 2% difference, I mean 1,500 people didn't get their aspirin on time. Women than men. Okay? So this is a problem. And you know what? I gave a talk on this over 15 years ago. And everyone was like, oh, you know, doctors heard it. Yeah, we got to do something about that. Nothing's changed. Still the same thing exists. So there are differences too, and this is something that docs will say, well, it's hard to diagnose, and indeed it is. Women there's less diagnostic accuracy for women with stress tests for a number of reasons, and also for nuclear scanning, and you can see the reasons here. But basically the bottom line is when you go and get a test to diagnose it, it's less accurate in women than it is in men. So they're sent off. I tell people, if you keep having chest pain, you know, we hear hook thinks it's a horse. If you keep having chest pain, and somebody says, no, you don't have it, then keep going back. Saying, well, tell me what it is then, because it's certainly not indigestion. So if we know all this about heart disease, and we know what causes heart disease. Remember AIDS? Remember when AIDS came out 20 years ago? You didn't know what caused it? It was hysteria around the country. No one knows what causes AIDS. It was hard to beat it, and we're starting to beat it now. We've known what causes heart disease for decades, and still the #1 killer. Why? An example, let me give you an idea. 2/3 of women, half the men, and 2/3 of women who die from a heart attack, they drop dead, and that's it. That's it. Didn't know they had a disease. They had no previous symptoms. They didn't know they had heart disease. 2/3 of the people that died from heart attack didn't know they had the disease. That's, you know what we call that closing the barn door after the horse has already left. And look at what we do. What do we do instead? If you look at smoking still, about 20% of American adults still smoke. Can you believe that? CVS is not going to sell cigarettes anymore. You probably saw that in the news recently. That's a big hit on them. And people say, how can they do that? I look and say, how can they not have done that? How can they not? How can you sell something where if used as directed, you know those ads on TV, use only as directed. If you use cigarettes as directed, it's the only product you sell that kills you if you use it as directed, right? Besides maybe McDonald's. But this is a problem. So smoking is still a huge problem in this country. And here's what's unfortunate, is that, you know, we used to target kids with Joe Camel. Well, look what they did with women. Virginia Slims. Look at the cigarettes, Virginia Slims. Look, it's long and thin like fingernails. That's why they made it that way. All right? And they targeted women with nice slogans. You come a long way, baby. This came out in the women's liberation era in the 60s and 70s. Now we're going to give you your own cigarette, right? You come a long way, baby, down here. You've come so far that now rates of lung cancer in men are fast approaching. I mean, women are fast approaching those in men. That's how far women have come with smoking. Women under age 55 who smoke have a 7-time risk greater heart disease than people who don't smoke. And here's one that just, I see this and all I can say is dumb. Half of people, I mean, men and women, who undergo stenting and angioplasty, who lie on a table for 2 hours, have a needle stuck in their groin, a stent put in their heart, go home and smoke. Forget it. Crazy. Crazy. But this is what happens. So, what about exercise? You know, the 2020 rule, about 20% of people smoke, about 20% of people are physically active. You know, if you think about this, a third of America is physically active. Goodness gracious. A third are physically active, a third are obese, and the other third, I don't know where they are. But here's the problem. This is what we have. If you think about it, McDonald's has on its sign over 4 billion served. How about Planet Fitness? Do they have that on their sign? They have like over 40 served. So because people just don't go doing this stuff. This is, and I can make everything up and you can think, wow, he's telling us stuff, is it all true? This is reality. So my wife and I went to see Bob Seger. Those of you who don't know, he's a band leader. We went to see Bob Seger back in 2011, and we were leaving. The concert got up, we started to go down the stairs, and I said, oh, stop, don't move. Now, if you can see that close up, that's my wife, and that's a look of intense exasperation while some guy is trying to hit on her. I saw this in talks, and somebody said, who's the guy talking to your wife? I was like, who is that? I didn't notice that part, but this is what I noticed. This is what I noticed. These are escalators going down. These are stairs. People are waiting in line around the corner to go down the escalator. This is America. I did not take 20,000 people and talk them into this. I saw this and ran back and took a picture. And of course my wife said, are you done? So anyway, we went down the stairs and got out fast, and all these people who are lined up waiting to go down an escalator. All right? As we all know, diet is bad in this country. Cholesterol levels very high. About half the people have high cholesterol. But you know the trick about cholesterol, right? Why is the cholesterol level set at 200? What's magical about 200? We have to raise it up, because basically it should be 150. But if we set it at 150, then it wouldn't be high cholesterol. It would be normal, because about 3/4 to 8% of people would have a cholesterol over 150. I mean, maybe in 10 years we'll say, now let's make it 250. Right? This is a problem. This is a huge problem. And by the way, same goes for medication with women. If you go to your doctor, man goes for a doctor. He's more likely to get a statin agent than you are for the same cholesterol level, and they're more likely to have their cholesterol controlled by it because they'll keep going back and back and back and be told to come back than will women. Another disparity. And of course, obesity, which is a huge problem in this country, no pun intended, a third people may get to 35-37% of American males are obese. A third of American females are obese. And even though obesity is not technically a risk factor, if you think about it, well, obesity leads to high blood pressure and to diabetes, which are two of the risk factors of heart disease. And of course, the lack of inactivity that goes along with it. So you get an idea, where did you see this before? Did we see a picture like this before? Same kind of thing, a big red swath right here, but that was from heart disease mortality. This is obesity, a little out here, this almost mimics it. Remember that one that I showed? About the same. All right? So you can see obesity and heart disease death rates sort of paralleling. And here's the part that's real sobering. Yeah, that's Generation X. It's Generation Triple XL. This is what's happening to our children. Do you know that right now we are bringing up the first generation that has a shorter life expectancy than its parents? Did you know that? Because of obesity. And if you look at this, the prevalence of obesity of overweight children is getting just out of control. A third of kids between the age of 2 and 19 are overweight or obese. I see young kids that are 7, 8, 10 years old that are obese. And what can you say to that one? What can you say? We know that if you're obese as a child, the chance of being obese in adults is extremely high, even if you lose weight in the interim. Okay? And a lot of that is just habits. And I'm going to tell you why I'm talking about that, because now we get the take-home messages. It is Cio temporo consulo. That's Latin. And I throw this in only because my daughter, I sit down with my kids, each of them gets one night a week, and we sit down and go over what they're going through at school. And my daughter, 2 nights ago, told me she's taking Latin. And what did I say? Why? Why? She goes, well, it takes you a little Latin America. I said, I don't speak it there. She's taking Latin. So I thought to myself, you know, what are the words? And that is the root of all language. But the take-home message, Cio temporo consulo, is to know, to control, and to advise. And that's what I want you to do, to know, control, and advise. Okay? To know your own blood pressure. You know, hypertension is often asymptomatic. To consider testing for diabetes if you're overweight. It's not something where you say, I really don't want to do this. I went for a physical about a year ago, and they checked my blood pressure. It was like 125/82. I said, no. I've never been over 105 in my life, and I've never had a diastolic greater than 70. Check it again. They did, and it was okay. And I realized I had just run up the stairs because I'm late for everything. I was late for my appointment. But, you know, I know what my blood pressure is. You should know what it is. You should know about whether you have diabetes or not. Have your cholesterol and triglycerides checked. There's nothing more sober to look at those numbers and see the little H next to it, or in the case of HDL, the L next to it. Make healthy food choices. I mean, we decide what goes in our temple, what goes in our body. Be active every day. No shortcuts. No more elevators, stairs. One of the things that makes me crazy about the heart vascular is there's no way to get there except by an elevator. I haven't taken an elevator until I came here. I walked 5 flights of stairs to my ICU hospital and down 5 flights. Now I sit there and I'm like, is anybody looking? I push the button. If someone comes by, I sit there, I'm on my phone like, it's embarrassing to take the elevator. You shouldn't be doing that. And quit smoking. No 2 ways about it. No 2 ways about it. If you smoke, you got to quit. If you see anybody smokes, you don't smoke anymore. You don't smoke anymore. Somebody actually asked me, they said, they were going to borrow our car about 2 months ago. Do you mind if I smoke in your car? I said, yes. I mind if you smoke. Why would you do that? You know, why would you do that? So, is this what you're going to do? Or is it going to make me think about, I had a patient once, a woman, true story, a woman that came and saw a exercise physiologist. I know we teach some course in this. And you can tell the story. A woman came and saw him, and he gained 9 pounds over her last well visit a year ago. And he said, you gained 9 pounds. She said, yeah, I kind of didn't notice, but I have. Anything different in your life? She goes, what? He said, eating anything different? No. Nothing different. She goes, no, it's been kind of a sad time because I lost my daughter 6 months ago. He said, really? He said, oh yeah. And so what are you missing? Well, I missed the morning and the afternoon walks. He said, there you go. Wrote a prescription, 1 dog. 1 dog, and go get a dog. Go back to walking, lose the weight. Because that's what they do. They're very valuable, these animals. Is this what you're going to do?
Oh.
And this is a stock photo. The other one's real. Or is this what you're going to do? Are you going to be active or not? And finally, not just know and control, but advise. You're very important. Watch out for your families and friends, signs and symptoms. You can save a life by talking to people and picking up they might have heart disease. Because remember, 2/3 of women die without knowing it. Without even knowing it. Set an example for a heart that lifestyle and teach your children. You know, the kids will pick up on everything we do. Everything we do. My kids are obnoxious sometimes. They'll go over to somebody's house, they'll eat lunch, go, is this organic?